Hello, everybody. How's it going? Happy Friday.
How are you? So we're going to talk about a little bit of shoulder stuff today. As always, Chris, EHS Physical Therapy Chiropractic.
Jake, Essential Motion Spine and Sport.
Now, typically we come at you with a lot of spine-related things. I mean, we do specialize and have a lot of experience and a lot of knowledge to help you in the spine, herniated disc, bulging disc, any kind of neck, shoulder pain or back, hip pain. Let's talk about though shoulder in the sense of it's not actually a neck this time. It's really a shoulder. We've had a couple of incidences here at the clinic. So these are like real life examples. These are not just, we don't come up with this stuff. Basically, this is like, it spurs our thoughts because we're like, wait a minute, we're seeing things, a little bit of a trend. Now we've had two younger gals that active sports.
One an overhead worker.
Well, yeah, one a little bit older, but still young. She's in her 20s. She just graduated, and can't raise her arm. The other one, a volleyball player, dove out in front of her, right? So dove out this way, and then now doesn't have any much abduction at all to the arm. So what would cause that? Once we clear this, and actually the one girl, the volleyball player, she had
a little bit of neck.
It was neck to start with, and she actually got a lot back, and she was back to serving, and then she dove and then hurt something a little differently.
Yeah.
But what would cause that? Why you can move it, say like this way, that way, but I just can't. It just stuck. It just won't go, and it feels very hard and blocked when you move that way.
Yeah. So in this case, we're probably talking about the labrum. Everyone's heard of that, but what really is it? So if this is our shoulder blade here, right? It's going to attach to our humerus, just like this. This is going to be our big arm bone, and this is the one that allows your arm to move through so many different ranges of motion. So like this is why we have such great range of motion. That ball on a golf tee kind of thing.
So but different than a hip, which would be more like surround, like in a joint.
Yeah, yeah.
Much thicker, much bigger.
So the labrum is like a little cartilaginous band that sits around that rim of that shoulder blade there, almost like this rubber band sitting around the end. It makes the shoulder more concave.
Yeah.
So you can
deepens the socket.
So you have a little bit more grab around that arm to keep it from moving through those dangerous ranges of motion, okay? But in this case, if we have I'm just gonna go ahead and say it's like a slight tear or something, a piece of that moving into the joint space here, this is why those girls are typically getting stuck coming out in this range of motion here, right about like 90-degree mark.
We saw one with abduction loss and one with flexion
loss. But you can see if I'm trying to raise my arm out to the side here, if that little piece of labrum folds into that joint space there, you can see that second little band sitting in that little space. When you go to raise the arm, it's going to pinch. Oh, I can't move anymore. I'm stuck.
Because the natural kinematics of the joint of that thing, as you roll, I won't move my hand in the way.
Yeah.
As you roll, go ahead. As you roll up, this thing has to slide down to keep the articulation with that socket. If it doesn't slide down and it just rolls, you would roll right off the edge.
Yeah, you'd roll right off.
So it's trying to go up and it's trying to roll, but something is catching it and it's just blocking right there. It won't let it slide and it won't let it roll. And that's why it feels very blocked and stuck with the motion.
Yeah, so do we need surgery for this, Chris?
Sometimes, and sometimes we can get it to lay back down, move out of the way. There's a possibility with certain motions and certain end ranges. So sometimes we can do, maybe an extension movement backwards or across the, horizontal adduction, something that will put enough pressure on that piece of soft tissue to lay it down, smooth it out, or move it out of the way. And then there are times when, no, we cannot get it to reduce, resolve, and then you got to kind of, clip that out or repair that spot. So we see it both ways. Sometimes we see
in the middle
had a slap, so we call that a
slap tear.
Just explain what that SL. It's an acronym.
Yeah, so SLAP stands for superior labrum anterior to posterior. So if this is the top superior side, so we're going to tear or injure it on the top from front to back, anterior to posterior. So it just means that
anywhere
top,
along there.
Yeah, anywhere along that top layer. You can have fraying, you can have true tear, you can have just a piece in fallen joint space.
Yeah, like a bucket handle type.
There's a whole bunch of different styles of
tear
tears
in there.
Yeah.
And that's from out to the side. So one girl kind of, we feel like probably dislocated.
Yeah.
So when that thing comes out of the joint, it can come out, but then when it comes back in, it can grab a piece of that edge of that, either on the way out or on the way in, and it grabs a piece of the or edge of that labrum and then shears it off when it comes back into the joint space.
Yeah.
The other one just dove out forward to dive for a ball, and that could then, the trauma could load the top of the joint space and tear it. So
Yeah.
slightly different, but we think that it's probably a labral issue or tear on both those gals. And we're going to try a little bit of conservative stuff first.
Yep.
And see if we can get things if we can quickly get the motion to return and the pain to go down, function to improve. Okay, good chance, good prognosis. If after a week or so it's like now it's not moving, we're going to have to get probably some additional information, probably a scan of some kind to see, if it's really. Now the scan is going to be very important in the sense that we already have an idea of what's going on. It's going to confirm or deny what we think is going on. We're not going to just rely on the picture to tell us all the answers.
Right.
We don't know anything. Let's just get a picture and it'll tell us what's going on. That's not necessarily true. It shows lots of things. We have to pick out the pieces and put the puzzle together and say, okay, this correlates well with what we see clinically and what they're lacking objectively with motion or function.
Mm-hmm.
Like, yeah, that's more because it could show a rotator cuff tear as well. Or something else, so well, that's probably not what's causing the pain. It's probably
the
this.
catch.
Yeah,
right.
So,
And then the decision to go to surgery, I mean, it's obviously patient dependent. So you have some input as to, what do you want to do?
With time, it still might calm down with time, but how much time do you have?
How much time do you want to put into it?
With the younger volleyball player, we may be like, okay, let's get this thing done so we can get back to,
Yeah.
moving faster than waiting, 8, 10, 12 months.
But even then, you got rehab if you go through
Yeah,
surgery.
either way, it's rehab.
So, yeah, you might as well try conservative care first, and because we've changed most of them. We've changed most of them in the past. These two girls were having a little trouble with. But
Yeah, you'll want to do some kind of conservative care, rehabilitation,
rehab.
exercises, chiropractic stuff before, in lieu of or before surgery. Either way you're doing
exactly.
it. So you might as well get as strong as possible, get as much motion as possible back.
Yeah.
So that's a good
That's it.
demonstration. It's a pretty cool way we've
Golf ball, rubber band,
Jake
and a
thought of a way
dum-dum.
to. Yeah, I know. Thought of a way to to show you that.
Whatever works.
The inside. Let's see if we can get that to focus a little bit on the inside of that thing. Come on, camera.
Yeah, you can see the rim there.
Yeah, that's so okay. We tried.
Cool. Shoulder questions, hit us.
Yeah.
Yeah.
Any questions? Let us know.
Yeah.
Everybody have a great Friday.